Taking care of infants is no easy task. It's not an easy feat to conquer. As in, parents out there are trying. Why do I say so? Because that infant cannot tell you what or how he or she is feeling. In this field, when a patient comes, you ask the person, how are you feeling? Do you have headache? Where does it hurt? When did this start? And the patient answers you. But for the infant, they can't tell you what's going on with them. You cannot ask them if it hurts, or you cannot ask them when it started. So it's just, you take notice of the signs. As the parents, you take notice of the signs. It's very important. And that brings us to the question, how do you know if your child is dehydrated? Well, for starters, I'll say that dehydration is when your body does not have enough water. Dehydration poses a lot of risk for adults, kidney failures, and the rest of them. Now imagine its risk on infants. Well, the first thing you need to watch out for as a sign that your infant is dehydrated is sunken fontanelle. Some people will be like, what is fontanelle? Don't worry yourself. I will explain what fontanelle is. Fontanelle is that part of the skull that is not yet formed after that 9 months. So the child is put to bed with that skull that have not yet formed. Now, fontanelle is located in the front part of the head and also in the back. But the sunken fontanelle I'm talking about is the one at the front, because the one at the back usually closes after a month or 2. So the sunken fontanelle is the fontanelle that sinks in. Sunken, sink. So if your child fontanelle sinks just like the one in image, just know that there's possible risk of dehydration and you need to give your child water. Another sign of dehydration could be little or no tears. Is your child crying but you're not seeing any tears, or the tears that come out is so little? Just know that it could be a sign of dehydration. Also, urination. How frequent does your child urinate? You wear your child pampers or diaper and the next 8 hours, no urine. Dehydration is visible in that sign. So you need to know that your child is dehydrated when there is little or no urine within 8 hours or 6 hours. Another sign is dry tongue or lips. It's also a sign of dehydration. It's very, very important you take notice of these few signs that I state. Some people will be like, okay, what can cause dehydration? The first thing that can cause dehydration in your child is diarrhea. Diarrhea has caused 16% of infant deaths. So it is very, very important to know that diarrhea can cause your child dehydration. Frequent stoolage of watery stool and vomiting can cause dehydration, and that you need to give your child frequent fluid. Fluid intake is very important. Oral rehydration salt is also very important to be able to give your child the fluid and the water that he needs for his body to stay hydrated. Another thing that can cause this dehydration is when you just introduce your child to solid food and you're not giving water, or you forget to give your child water. Some people are doing this. You forget to give your child water. You know, when you're giving your child breast milk, your breast milk supplies the water that child needs. But when you have stopped breastfeeding and is now giving that child solid food, you need to be able to give your child water. Very, very important. When you are introducing solid food, you need to be able to give your child the water that he or she needs. Now, did you benefit from this video? If you did, follow me, comment and share this video so that your friends and other mothers can also benefit from this video.